So we're really happy that you guys are here, and I'm so excited to introduce Catherine Justice with us. Catherine, I had to write this down because her title is very long, but she is the founder of The Art of Wellness, and she is a fellowship-trained integrative medicine expert, certified yoga therapist, integrative physical therapist, and craniosacral therapist. And I'm probably even missing some. But she's going to do a presentation for us, and then we'll have time at the end for Q&A. So for those online, feel free to send any questions in the chat box. And I would like to note, too, that she's not going to be touching on exercise and nutrition, which can kind of be lumped into this as well. Our third session of this series, so there's going to be 4 of this wellness series, which thanks to the Minnesota Cancer Alliance, they provided this grant for us to work together. But on May 19th, it's a Tuesday from 4 to 5:30. It's going to be all about nutrition and exercise. And so we'll have a registered dietitian with us, as well as an exercise specialist. So very excited about that. And we do have both of those registrations open too. So I will hand it over to Catherine, and she's going to lead us through the presentation. So thank you.
It's such an honor to be here with you all. Thank you so much for taking the time out of your day to come. We're going to talk about traditional, complementary, and integrative medicine approaches to cancer care. And if you're like, so not even exactly sure what the title means, you're in the perfect place because we're going to talk about all of it. Also, you will notice lots of pictures of cats in my presentation. That's kind of my signature. So you're welcome unless you're a cat lover, and then I'm sorry. You're not again. But a little bit about me, just to kind of orient you to the perspective that I bring to this work. So I started my professional career as a theater artist. That was my first passion, my first love. And it was through working in theater spaces that I was introduced to the world of yoga. And I then was like, great, yoga plus theater, this is a great life, except for very hard to make a living at it. So I had a little, like in my 20s, realized, what I liked most about yoga was helping people heal. But I felt like I kept running into the limits of my knowledge. Like I just didn't know enough to really do it as fully as I wanted. And I was having trouble making a living. So to mirror those two things, I went to graduate school here at the University of Minnesota for physical therapy, with the whole idea that I was going to go there to help use yoga to help people heal. And when I realized in the PT that that's what I was doing, I very quickly realized, well, there's a whole name to this. This is called integrative medicine. It's what I'm practicing. And so I ended up doing a 2-year fellowship in integrative medicine, which really changed my life and expanded my knowledge base even more and gave me an even broader perspective than just within the field of physical therapy. And what I also realized throughout all of this work, whether it was theater, yoga, or healing work, that for me to feel invested in my work, that I have to feel like I'm making the world a better place. And so that's where the idea of kind of a commitment to social justice, no matter what work it is that I'm doing, that I'm working towards making the world a better place. And so that's actually, come on in. You're fine. That's extra why I'm excited to be here with you all today, because to me this feels very like mission-centric for the work that I want to be doing. So what we're going to do today, first we're going to talk about some definitions to just sort of orient ourselves to what is this traditional, complementary, and integrative medicine thing. And then we're going to go through some very specific modalities or healing systems, and look at some of the research behind, we're going to get super nerdy, and look at the research behind how they may or may not be useful for people on a cancer journey. So we'll look at yoga, we'll look at meditation and mindfulness, acupuncture, Tai Chi and Qigong, energy healing, and we're going to very briefly touch on supplements. That's probably the least of the topics, but we will talk a little bit about it. So to that end, we're going to talk first about what we're talking about, which is integrative medicine or integrative health. These two terms are pretty much used interchangeably. And the idea of what integrative medicine, integrative health is it's really about the relationship between a provider and a patient, trying to take away the hierarchy of saying that the doctor or whomever, the provider, that they're the expert and the patient comes to them and the provider tells you what to do, you do what they say, and that's the end of it. It's really about fostering this relationship of collaboration, taking the hierarchy out of it and being able to have an authentic conversation, an authentic care plan with someone that meets their needs, not just what the doctor thinks you should do. And because of this, it tries to, as much as possible, to take into account the whole person. So not just your physical body, but really all aspects. And we're going to talk in a minute about what that means, that idea of whole person. But it's informed by evidence. So we're not just kind of going off the map. We're sticking with evidence. And what I like to say about integrative medicine and integrative health is it's the best of both worlds. We can have the sort of conventional medical approach, and we can go off map a little bit with some other things that we know have healing potential to them. So that's why it makes all appropriate therapeutic lifestyle interventions to really find optimal health and healing. So it's not just about putting a Band-Aid on and sending you on your way, but it's about how do we optimize? How do we make your life not just not terrible, but as some say it can be. And related to that, sometimes you'll hear like integrative medicine, integrative health, and this idea of whole health, whole person health. People use these terms synonymously too, but to me, there's a slight difference. So the idea between whole health or whole person health is this idea of taking the whole person into account of their physical well-being. And we'll talk about like all these different aspects of it in a minute. But that idea of the whole person is one part of integrative medicine, but it's not. I don't think these two things are the same thing personally, but I am in the minority. So that's my little soapbox. I think they're both important, and I try and live and embody both of them. But to that end, I really like this image. So this comes from the VA, which has been really a trailblazer in integrative and whole health initiatives. So I like this picture that they've created, which is the idea of putting the person in the center. So rather than, again, just like saying, okay, here's your disease process, here's your treatment, go, you're good. It's really about what's meaningful to you. And some people use the idea of like, instead of what's wrong with you or what's the matter with you, they'll say what matters to you. Yeah. Or what do you want your health for? And they'll start from there in creating a care plan. And so again, it's like the person surrounded by all these aspects of things that can move one's person, move you to a state of better optimal well-being. So whether it's the body, your environment, your personal development, nutrition, all of these things matter. And then I like that they kind of surround it in sort of the evidence and treatment options, including complementary and alternative or integrative, however you want to talk about it. And then it's all surrounded by community. So we're all kind of there supporting each other. And I really like this image. It really resonates for me. And this is maybe even a nice moment to, well, we'll do a pause moment in a second and kind of dive deeper because this is another, you're going to see this is what my theater background comes out. Everything has a metaphor. So here's another metaphor, this idea of a tree. And generally, if you come into the doctor, oh, yeah.
Are you going to send these slides anywhere?
We can, that we just got asked. We can definitely send these out. Yeah. Yeah, Kathy, we can send, we'll email them out.
Yeah, that'd be great.
Yeah. So this tree metaphor of like, if you go in to say the emergency room and you have a peach or something like that, they're going to put a Band-Aid on it. That's like the symptom level. Like, okay, here's your symptom. Here's something for it. See you later. Which in an emergency room context is probably appropriate. That's the kind of care you want. But when you're really kind of struggling with something deeper than that, something bigger, you want to try and get down into that trunk, if not into the roots. So the idea of that whole person, again, mind, body, spirit, social life, your environment, the society that surrounds us, your personal history and culture, like all these things are part of what can drive us to a greater state of health and well-being, or pull us away from it too sometimes, especially if they're not taken into account. And then the idea of like when we start to sink into this whole person, maybe we even get closer to root causes, to really understanding where's the real foundation, where you're unwell and how can we get down to the root level. And then seeing too that it's surrounded by kind of external society, by community. SDOH is social determinants of health, which we'll talk about a little bit at the end. And exposome is just another name for sort of environmental exposures, things we're exposed to in our environment. So in thinking about this model and the VA one, I'm curious if like what's coming up for you guys, like any reactions to these ideas of like this whole person approach. Does it Anything, just initial reactions about it? There's no right about it, it's just obvious.
Definitely resonates.
Yeah.
Makes more sense.
Yeah. It's kind of the care we all want, right? Like, not just for ourselves, but for our loved ones, like, too. It's really like, this is how we all want to be treated, like our whole selves. And I know there's a lot of things in the medical industry that make it harder and harder for providers to do this. Time being a huge one. Like, when we're limited in time that we have with people, it's, you got to be very strategic into how to find your way into this model. So that's just a system issue that the world needs to reconcile. That's another soapbox. There it is. So this is one more metaphor, and I promise to lay light on the metaphors after this one. But this one, it's a metaphor I use a lot when I am working with people who experience pain. But I think it really works for just about any challenge that we can experience in our lives and in our bodies. And the metaphor here is that as if each of us is like a house, but we're kind of a weird house because we're a studio house. We only have one room inside. And inside of us, that's where just everything mixes together. So this idea of body, mind, spirit, like society, environment, all of that, these are fuzzy boundaries at best. Like, there's actually no concrete separation between our mind and our body. Our mind is part of our body. Our body is filled with our mind. Where does the spirit, where's that separation? It's actually not that separate. So we're one room inside of us. But we're also kind of a weird house because we have lots of doors. And so each of these doorways, again, when I'm talking about pain, it's the idea that it's a place where pain fits into the body. But pain can be physical, it can be emotional, it can be social pain, spiritual pain, like all sorts of ways that pain can come in. But once it's in, it affects all of us, the whole person. But we have to remember that all of these doors are two-way. So they're also an ability to exit. So this is where, like, pain, illness, dysfunction, whatever we want to think about, these are ways that it can come out of our body too. And so sometimes if one door is particularly challenging, if you're struggling with a disease process, that in that in that body, things aren't going well or things are struggling, that's when we say, let's find these other doors. Let's open up some of these other doors as a place to optimize well-being in your life and optimize healing in your life. So that even if there's struggle one place, it's one room, we can work as hard as we can to get it out through the others. Does that make sense? Yeah. So you're going to see kind of a lot of this, and we're going to come back to this image at the end too, to think about maybe strategizing together ways of opening more doorways in our lives. I wanted to give a shout out to the Society for Integrative Oncology. If you have not yet come across this organization, it is fantastic. So if this talk resonates with you, that's like the number one place that I would send people for more information. It's also, because it's a society, there are particularly physicians and nurse practitioners who belong to it. So if you want to find a provider that is invested in this approach, this is a great resource to find people who are a part of this community. And so again, it's looking at that whole person approach to cancer care. And they have done a ton of research, and they are a hub for research as well. So they have they've got blogs, they've got podcasts, they've got all sorts of things on the website to help both providers and the general community stay informed about the evidence. So there's a resource slide at the end that will have their website again on it. So we'll come back to it. And again, and then I also wanted to just take a moment to think about, when we talk about informed by evidence, what exactly that means and what we're talking about when we're talking about evidence. So evidence-based practice or evidence-informed practice, again, those words pretty much mean the same thing. It's the metaphor. I said only no more metaphors. Okay, metaphor. I didn't make up this one. Someone else made this metaphor up, so I'm using someone else's metaphor. Is of a three-legged stool. And the idea being that one stool is what the research tells, one leg of that stool, research, which is very, very important, but it is not the only leg. So another leg of the stool is provider experience. So when you find a trusted provider, like their experience matters, and they're going to help guide you and personalize. They can see the evidence, and they're going to help personalize it for you based on their experience. But there's also a third leg, which is your experience, which is the patient's preferences and your life, your desires, your goals, the things that matter to you. And each of these three are supposed to have equal weight. Now, in practice, I think we outweigh one of these three legs. I think we outweigh what the research says and don't give enough credence. And I'd say that in my experience, the shortest leg of the stool is the patient leg, which we need to work to reclaim that leg, to take back our power, to say what matters to us matters. And so that's a big part of this work too, is to try and like really emphasize patient preference in, again, in collaboration with the others. And when we're thinking particularly about integrative approaches, we're also thinking within this three-legged stool of where evidence is lacking, but also just because evidence is lacking somewhere, it doesn't mean it's not important or it doesn't work. So if we want to do a really thoughtful evidence-informed approach, we're going to be weighing risks and benefit. So say there's, we're going to come to look at yoga for an example, which is like the example I bring up because it's my area of expertise. So there are limits to where evidence has shown that yoga can be effective for ... However, as we know, the benefits of doing yoga, like there's very little risk to it for most people. If you're finding a gentle, like supportive environment, very safe practice. If you're doing it at home with a yoga mat and maybe a friend or two, it's pretty low cost. It doesn't have to cost a lot of money to do it. So here we have low cost, very low risk, very potential for high reward and benefit. Even if the evidence isn't there, that's when these other two legs of the stool come in and say, this might be worth trying. Similar for things like, and when you get to the nutrition lecture, you'll find this too, that maybe there's limits to what nutrition has proved will like blah, blah, blah. But what are the benefits of eating more fruits and vegetables? Like they're huge. And these days it's not low cost, but we can, hopefully we can find cost-effective ways of doing it. So again, it's like weighing risks and benefits, risks and rewards. If we can find something that's low risk and potential for even a little benefit, even if the evidence isn't there, I say go for it slowly. And that's what I would tell my patients and my family members. So general, what we call clinical practice guidelines. So these are published guidelines by the Society for Integrative Oncology that tell providers, like, these are the things that we have the highest level of evidence for and that we know will have a high likelihood of being effective for these specific things. So when we're looking at TCIM, or traditional complementary and integrative medicine approaches with cancer, we can find that if someone is struggling with fatigue, what they have found research-wise is that mindfulness-based stress reduction, which is a form of meditation, mindfulness-based cognitive therapy, which is a specific form of psychotherapy, Tai Chi and Qigong, the very best evidence in general across cancers. There's strong recommendations for fatigue, particularly in those mindfulness-based programs, which is kind of interesting. It's not even that fatigue is more influenced by our mind than anything else. I think that's kind of cool. They also have a clinical recommendation against using cannabis or cannabinoids as a cancer-directed treatment. However, that doesn't mean that it can't be a support to you in other ways. Like it's not going to be directed towards the cancer. But if it's helping with pain or sleep or other things, that's something to talk to your doctor about. And that's where the other two legs of the stool are really important, of like you and your doctor or other provider helping to make that informed decision for you in specific versus this is just in general is what it's talking about. For anxiety, you're again finding mindfulness-based interventions, yoga, hypnosis, relaxation techniques, music therapy, reflexology, acupuncture, Tai Chi, and lavender essential oil. So all of these have evidence showing that they can be helpful for anxiety. And then the strongest recommendation, again, is that these mindfulness-based interventions should be offered to people both during cancer treatment and post for depression. So fatigue and depression are the two that really are strong. fatigue, depression, and anxiety with any of these mindfulness-based approaches. And if you were like, I'm not sure what mindfulness is, don't worry, we're going to get to it, what it is. Some other basic kind of clinical practice guidelines and recommendations, just gone into a little bit more depth. So get the screen a little closer to me so I can actually read it. So anxiety, we're looking at, again, those mindfulness-based interventions, yoga, relaxation, music, reflexology, and that's during active treatment. And then post-treatment, again, it's mostly the same stuff, except acupuncture gets added to the list for anxiety after treatment, which I think is kind of interesting. And then when we're looking at depression, again, during active at the top and after treatment at the bottom, it's a lot of the same stuff. It's mindfulness, yoga, relaxation, music. Tai Chi and Qigong gets added, again, after treatment. Some evidence there. Doesn't mean that it wouldn't be effective during. Again, this is just what they're looking at, kind of that. They're really looking at that first leg of the stool when they make these guidelines. And then when we're looking at pain, cancer-related pain management, here again, we're looking at acupuncture as a strong modality. Reflexology, hypnosis, and massage are all things that have some good evidence behind them for cancer-related pain. And then if we're looking specifically at fatigue, here's where they say exercise, cognitive behavioral therapy, mindfulness, Tai Chi, Qigong, psychoeducation, meaning kind of educating ourselves about our mind and about how our minds and bodies work, as well as American ginseng. So here we have our first supplement thrown in there. May be recommended for adults during cancer treatment. And I always say any supplement during cancer treatment, you got to tell your doctor, even if you're like, it's an omega-3 or it's something I Kyoku-10, like my friend told me this is good for this or whatever, you get it over the counter, just tell your team, tell everyone on your team, bring your bag of supplements in or pictures of them, because it matters. And there are sometimes some contraindications in very seemingly safe over the counter supplements that may be interacting with cancer medications. So you just want to keep everybody informed. But American ginseng is one of the most commonly recommended supplements and herbs for people undergoing a cancer journey, particularly for fatigue. It's energizing. It kind of boosts your body. And it also has slight, what they call an adaptogen properties, which means that it helps with stress, helps your body process stress. And then survivors after treatment for fatigue are looking at, again, some of the same stuff: exercise, cognitive behavioral therapy, mindfulness, acupuncture, yoga, moxibustion. Moxibustion is a traditional Chinese medicine practice with, I forget the name of the herb, but it's an herb that they kind of burn. And then I've never had it done to me.
Mugwort.
Mugwort.
They
kind of burn it, and then it's made into, I think, a pumice almost, and then applied to the skin. So I don't know a lot about moxibustion. I didn't even know it was mugwort, but thank you.
I know.
And then at the end of life, cognitive behavioral therapy and maybe corticosteroids for fatigue at that point. But they say do not recommend L-carnitine, which is a supplement, antidepressants, wakefulness agents, or routinely recommended psychostimulants for cancer-related fatigue. Again, those all have a lot of side effects to them that in the long run are probably not going to be helpful for most folks.
What's a wakefulness agent?
Ambient or caffeine. Ambient is the opposite, but caffeine or energy boosting kind of.
Or Adderall.
Kind of basically any sort of stimulant in the body. So then here's some specific clinical practice guidelines that the Society for Integrative Oncology has about lung cancer. So now they're looking specifically into this type of cancer, which you're going to hear, again, a lot of the same stuff, which is mind-body modalities, mindfulness, yoga, massage, pulmonary rehab, which is a huge, not enough people, I think, get actually referred to it with active lung cancer. So that's something that to keep in our minds, even though it's part of conventional medicine, it's underutilized. Acupuncture, particularly for nausea, vomiting, pain, and peripheral neuropathy. And then again, we have a little bit of nutrition here of non-starchy vegetables and fruits, reducing meat consumption, maybe even high calorie and protein supplements, and omega-3 fatty acids. And some integrative therapies for lung cancer. Again, now we're looking at reviews. So these are the review studies, mean that they take a whole bunch of studies, usually high quality ones, and they lump them together and say, if we look at all 11 of these studies, what conclusions can we come to? And so here they're again looking at mind body exercises like yoga, tai chi, and qigong for improvements on the 6-minute walk test. So needing more energy, better endurance. Another review of 6 studies that said meditation, yoga, stretching, and breathing helped with distress and depression, helped with improved quality of life, self-compassion, so important, mindfulness, and reduced rumination. And then we have now a review of 22 randomized controlled trials. So this is, and this is just from last year. So this is a really great study that found Tai Chi and Qigong reduced anxiety and depression, improved sleep, increased that 6-minute walk test, improved quality of life, and even improved pulmonary function tests. So that to me, if I had a loved one with lung cancer, that would probably be the main thing I would try and get them into personally, would be a Tai Chi or Qigong class, because you're getting a lot of bang for your buck with one intervention. And here's the sad state of things when we look at ovarian cancer. Yeah, I know, which is like, I have a reaction to this, having had a loved one who is a stage 4 ovarian cancer survivor. She's doing great. Then more research is needed. But again, it doesn't mean that any of these things aren't effective. It just means it hasn't been studied enough. Yeah. But the one thing that I could find was there was a study that looked at restorative yoga for cognition. So interesting. So they had one group do a vigorous yoga practice, more energetic, and another one do a more relaxing, a more still, a more calming yoga practice. And the calming one improved people's thinking abilities better than the vigorous one, which I thought was really interesting. And I've seen that in other populations outside of cancer, where they look at actually the more calming, relaxing yoga tends to have a better impact than a more vigorous yoga practice. And that's when we're going to start to talk about yoga. Again, it's just my specialty, so I get really excited about it. So the word yoga, it's a Sanskrit word, because yoga comes from India. It's an ancient practice, over 6,000 years old. And the word means union. So we can think of that in lots of ways. We could think of that as like mind, body, and spirit uniting. We could think of it as just breath and body moving together. We could think of it as union with a higher power or with our community, like any ways that things are being drawn together, yoking, like sort of the word yoke kind of comes from the same root, union. And so there's lots of aspects to yoga. We mostly think of bendiness, of like pretzeling ourselves, which again is overrated. And that's how people hurt themselves in yoga, in my experience, is through being overly bendy. But there's a whole aspect of lifestyle and ethics that go along with yoga, which the root of it is non-harming, which, peacefulness, non-violence, and truthfulness. So those two are the core of yoga. And so anything that you do in your life that brings non-violence and brings truthfulness into the world is actually how you can practice yoga. We're hopefully all doing yoga every day, even if we don't call it that. Postures and breathing are a part of the practice too, and meditation is as well. So it has kind of all of these are part of yoga. And so when we look at the research behind yoga for people who are on a cancer journey, these are the main things that we find, which is gives you energy, it helps you feel better emotionally, improves quality of life, improves our sleep, and there's even some preliminary evidence, so not as strong, around reducing inflammation, around helping with lymphedema, improved range of motion, improved mood, decreased nausea, improved cognition and thinking, some help with osteoporosis, and urinary symptoms, and decreased pain. So again, a lot of bang for your buck here. And there's a few more studies, and then I might pass it off to my new friend here who's an expert in yoga. But a couple more reviews. So these are studies that bring a lot of other studies together and say, what do we know based on a whole bunch of them? Particularly this top one here, because it's so recent. It was just from this year, looking at cancer-related fatigue and quality of life. And again, that they found that it probably, so here's like, researchers, we like to be very cautious about making big sweeping claims, especially about these complementary and integrative modalities where it's impossible to have a true blinding. You can't do a blind yoga. Like one group, you're doing yoga, you get to yoga, like yoga is not a thing. So there's no control group that, thinks they're taking a placebo yoga. So right away, these things don't always fit into our scientific method, and that's okay. Like we do the best we can. Because again, we're going to have all three legs of that stool to help make informed choices. So yoga is not a pill, but they say it probably has beneficial effect compared to no yoga on fatigue. It might have a beneficial effect compared to no yoga on in the medium term, short and medium term, and maybe even in the long term, as well as improved quality of life. Similar with depression and anxiety. Some others looking at physical and mental health, and because I want to make sure that we have time for all of these things, I'm going to go a little faster here. But I do like to point out that research is not always about numbers, that it can be done about what they call qualitative, which just means how we feel about things. And so this was a really cool study that looked at, it was a review, so it took a bunch of studies, but it was all looking at qualitative, so how people feel when they do yoga. And these were the themes that came out of all of these studies looking at it, so that they found that yoga can support improvements in multiple dimensions of quality of life, particularly in women diagnosed with cancer. So most of the yoga research has been done with people with breast cancer. That's where the primary populations have been studied. And that they found that women diagnosed with cancer experience an interaction between these quality of life dimensions, that they're not so separate. Breathwork and meditation are really important. So not just focusing on the bendy, but focusing on the breath and the meditation. And that yoga practice may support some lifestyle and behavior changes outside of yoga practice. It may make us make different choices about the food we eat, and may help with the social support and things like that can bring to our life. But that there are specific barriers and motives to kind of what help or hinder people get to and from yoga. So here's where, I don't know if you have anything that you want to just share about your yoga practice or your classes, but I would love to hear if you're okay.
Yeah.
And what was your name again?
Yeah, my name is Carol.
Yeah.
Berg, and I teach yoga, and all my students are over 65, and we have been, some of us have been doing it for 10 years, 6 to 10 years. I've been teaching, done yoga for about 20 years, but it has been, with people, the oldest person I've taught was in her 80s. Now I'm 75, and one of my other students is also 75. And so, we have stuff going on all the time, different things fall apart. And, and so, we're all in physical therapy, one thing or another. And it has made a big difference. We have one of my students was diagnosed with cancer, and she has kept, as soon as she came out of the surgery, it was, it was an endocrine cancer. So it wasn't a real aggressive one, but she had a pretty major surgery. She came back and was doing yoga very, very quickly because it helps, because it is mind body, we have we do it 3 days a week. It's our own little community online. So she is in Iowa, another one is in Maryland, and, we just, and I have had, my health journey has been, I spent many years being a Diet Coke addict and just, dieting, not diet, just doing all kinds of things. And I've done a lot of really good, yoga has made a difference. I ended up quitting drinking because I just thought, wait a minute, this doesn't fit, whatever you put in your body. And eating healthier, and I no longer drink Diet Cokes, and all kinds of things. But it really has made a difference. And I just went into a physical therapist, and she looked at my MRI for my spine, and she just went, "Whoa, okay, well, it's a good thing you do yoga," because you have so many stenoses that they couldn't do surgery. It wouldn't help. But it doesn't hurt. I don't have a problem, and I'm not that great at yoga. I just keep doing it. I can't, turn myself inside out. I just do like my yoga. So I don't know. I think it's been quite amazing to me. And the other thing is, the end of the class, we do a loving kindness, because I've done some Buddhism things. So we've done the loving kindness meditation. And then also, from the first time I did yoga, the teacher said namaste at the end. And that namaste just went to my heart. It's like the light in me honors the light in you. And it took me a long time to realize that there was a light in me, no matter what. No matter what.
Thank you.
Yeah.
Thank you.
Anyway, and I think we all suffer that. So that's the self-esteem thing.
Thank you. Thank you so much for sharing. So way better than I could.
Well,
so I appreciate that.
That's my story.
Yeah, which matters, and it's important. And that's a leg of the stool. And that brings us right into meditation and mindfulness, which is an aspect of yoga. You can do meditation and mindfulness within a yoga practice, or you can do it through a seated meditation practice. And on a slide in a minute, I'm going to show all sorts of other ways that you can practice it. But mindfulness is defined as the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. So I think of it as mindfulness as having these three ingredients of intention, like we're doing it on purpose, attention, we're paying attention right now, right here, and we're letting go of judgment, which is a really tough one, that third one. But there is like a whole, again, this is another great resource of the system of mindfulness-based cancer recovery. So people get trained, and you can find people who've been trained in this particular field of mindfulness that is specific for people on a cancer journey. So again, you'll have the slides, find all that info there. But this is another metaphor. Okay, I've got another one. Fine. Jar. So I think of like the sort of the ingredients, these three ingredients of intention, attention, and non-judgment. Like they go into things, but what that jar is, what that container is, could be just about anything. So it could be seated meditation where you practice these three things. Or it could be yoga where you're doing it, paying attention in the present moment, letting go of judgment. You can walk mindfully. You can take a walk where you're in this state. You can eat mindfully. You can have social experiences with another person. You can be mindful. You can be present and intentional, non-judgmental. Your healthcare experience could be mindful, essentially. You have, mindful experience with chemotherapy. Not easy, but you could, or with even just an interaction with a healthcare provider. There's all sorts of ways to practice it. And here's some, again, more research showing particularly this mindfulness-based stress reduction, which you see a lot in the research, is a or MBSR, it's often called. And it's a program, it's an 8-week program that's standardized. So it's pretty similar, no matter who's teaching it or where it is. And so because it's standardized, it's a little easier to research so that they can look at it. So an 8-week program that basically teaches you how to meditate, how to find this mindful state. And mindfulness-based stress reduction typically has yoga along with it. So they have kind of seated meditation practices and moving meditation as part of it. There's free ones online that you can find. If you Google free MBSR, you can find teachers who do it for free online. And there's also a great resource in town is the Center for Spirituality and Healing at the University of Minnesota. has mindfulness-based stress reduction classes, usually more than one happening at any given time. And those are, I believe, on a sliding scale cost as well. So they try their best to make it affordable. And so again, what they found with these mindfulness-based stress reduction courses is anxiety, depression, post-traumatic growth, meaning like you've been through a trauma and how to get out of it. Like this is a really wonderful way. And QOL, which is quality of life, depression, anxiety, fatigue, all of these things. Before we go on though, like I always like hearing personal experience, and if anyone ever experienced mindfulness before in any way, shape, or form, yeah, I don't know if you're comfortable sharing.
Oh, yes.
About
I've been doing meditating 18 months now, so 2 hour a day. So I went to a meditation center that's Vipassana. So they have a lot of centers all over the world. So that was really help you to just to be awareness and observe all your body sensations. So it really helped relaxing. So before, I really don't know how the truly full relaxing feel like now. So afterwards, you just know that's a joy.
yeah,
That's a peace. Then yes, so that's then develop a equanimous mind, means no judgment. So you just watch, observe what's going on and what's happening. So you can I also do another meditation or breathing work. So I keep kind of sometimes you just have so many thinking in your head, and you know that's you just cannot break and just stop it, you know. So but you realize you watch it, and actually more you watch it, and the thoughts it just disappear, go away. So you don't just really try harder to not thinking about it. Just like you know, you being diagnosed with cancer, you always worry about the recurrency of, you know, all this anxiety, because that's is for the future, you know. So there's no good, and you don't know how to manage it. And but as long as you live mindfulness lifestyle, so things just come out and just kind of effortless. That's why for the meditation and the yoga practice really is really a big okay.
Thank you so much for sharing. You guys are amazing, incredible. And I think a lot of people often feeling in a cancer journey that their bodies betrayed them. And so these mindfulness practices can be a way of like re-befriending your body and like coming back to it in a way that has love and that has like reestablishing a healthy relationship with our bodies, a loving relationship with our bodies, which is not easy. And that takes us kind of in some ways, again, acupuncture is a great next step for this, because acupuncture comes from China. Most of the traditions of acupuncture, some come from other places in the world. And it's one aspect of traditional Chinese medicine. And here's what they found. Again, research-wise, pain, fatigue, insomnia, quality of life, nausea, vomiting, as well as peripheral neuropathy, some bone marrow suppression, super interesting. Cancer-related menopause symptoms, nasopharyngeal cancer-related dysphagia, throat, and difficulty swallowing, lymphedema, gut dysfunction, xerostoma, and depression and anxiety. And I'm reading xerostoma. I was like, what is that again? So you might
Dry mouth.
thank you. Thank you. That was in my notes. I was like, wait a minute. That in my notes.
I only know that one great.
The collective wisdom, we are supporters. Really appreciate it. And so again, some reviews, look at insomnia. I want to make sure we have time for questions, so I'm going to go a little faster now. Insomnia, pain, peripheral neuropathy. And I'm going to like offer up for some personal experiences at the end too, because I want to hear if people have experienced acupuncture or Tai Chi and Qigong, which is another part of traditional Chinese medicine. So it's another part of that system, both during and after treatment. So that's what the research is showing, that particularly fatigue and sleep. And then looking at energy healing, which is another modality, very, very low risk. Oftentimes people aren't even physically touching you with energy healing. They're not even touching your body. So super low risk. Sometimes it's called, like, Reiki is one form of energy healing, or therapeutic touch, healing touch. So we have limited or mixed research supporting it for pain and fatigue. However, again, 3 legs of this stool, just because research hasn't shown it, there has not been a lot of research done on this work. So again, just because it doesn't show it to be effective doesn't mean it isn't. It just means we don't have that information yet about it. Very low risk. And then with supplements, I've talked about just sort of the interactions, the issues with that. But also looking for these third-party verifications is huge. So some people like to say supplements aren't regulated, and that's actually not true. They are regulated, but they are regulated by the FDA. So they're regulated in the same way that food is regulated, not or in the food category, not in the drug category. If it's regulated in a drug category, you have to show that it's effective in order to put it on. And if it's in the food category, you have to show that it's bad for you or that it's lying to get it pulled from the market. So it's slightly different. And it just means that, like, when they do these sort of just general studies of looking at, hey, what's in these supplements? If they don't have a third-party seal, it's very up in the air of, like, are these things actually in here in the quantities they say they are? It's kind of the Wild West. So if you have any of these third-party verification seals, this is the one I see the most. It's this USP seal. That means that they have had a third party look at the supplement and say, is it actually what it says on the bottle? Is that what's actually in it? Yes, it is. So that's my recommendation in general, is to look for one of these seals, particularly that USP is the one I see the most. And then you know that it's high quality, that what you're getting is what it says. And then always, again, talk to your healthcare team, just let them know. And there are ways that the healthcare team, they should be able to look it up. Like, there's a database that shows here's all the interactions that could possibly be occurring with these supplements. And then this takes us back to the doorways, which is where I wanted to, like, come back to this idea with acupuncture, with energy healing, Tai Chi and Qigong, of, like, or any of these, like, modalities, really, like, how, like, any reflections that people have, how they open up different doors in different ways, or any experience that people wanted to share with any of these other modalities.
I like the idea when you said it's a door that you go in, but it's also a door that you can get out of. I really like that.
Yeah.
I mean, I didn't even think of that.
Yeah. So, like, social can be bad. I mean, it can come in socially. Like, and again, being on a cancer journey can be very isolating. It can feel very lonely. But finding community, like, here, we're going to open that door, you know? Yeah. But I think I interrupted you. Sorry.
No, that's all.
Yeah.
And you could go in one door causing pain, but come out another, which I really like.
Yeah.
Because there might be another way there to get out. And I did like what you said about the mindfulness and really looking at, you know, like looking at the pain and looking at the body and trying to look at it without judgment. It's
Powerful.
yeah,
Very powerful.
And I go to Common Ground and meditation center, and it's Vipassana meditation. And they just did a Buddhist studies on the body. And one of the meditations was just so interesting that it took, you know, you go into meditation, and then they said, you know, in Buddhism, the body has 3 parts. You know, it has your skin, your outer part, your inner part, your organs, and your, you know, flesh and guts, everything like that, and then your bones. And then in this meditation, then he just said, okay, Now just think of the skin on your head, the skin here, the skin here, skin here. And then put that skin in the pile right here. Yeah. And it was just like when you're, just silent, fish, please. And then you start thinking about the inside the skin and your organs. And put that in the pile right here. And then your bones. And then, where are you? So we're still there. Yes. I was just like blown away.
Wow. Yeah. Oh, thank you. I think there's some questions online.
We do have questions, but I just thought I would share a comment too of people listening. Someone said, I love going to acupuncture. It's so relaxing. And I'd love to do yoga every day. I wish we had more classes available. So I thought that was nice. But yeah, we do have a couple questions. We can open it up. I know we've got about 5-6 minutes left. Yeah.
And I'll put up the resource slide here too. The only thing I wanted to mention here is within that social determinants of health, which I mentioned at the beginning, of kind of access to quality healthcare, the neighborhoods we live in, our economic situation, education, all of these matter in cancer too. And just kind of as a call to action for all of us to think about these things and about what we can do in our communities to give everyone access to the care that they need. And then that brings us into questions, but I'm going to keep these resources up here too. Yeah. So anyone questions here or any?
Someone online, then I want to make sure if you guys have time too, where can people find music therapists? I'm sure this resource
brings us right onto here. So part of it, so outside of my private practice, which is the Art of Wellness that was on the first slide, I work at HCMC, or Hennepin County Medical Center, as the program manager for integrative health. And our team is so proud of this. Let's see if I can get it to link up here. This website that we've been working with the state of Minnesota to help create, which is called No Pain MN. And it has all of the evidence-based modalities for pain care, including music therapy.
Nice.
Therapy here. Here we go. So if you're looking for a music therapist in Minnesota, you can click on the map and search for one. So here it tells us a little bit about it, but then we click to find a provider. And there aren't a lot, but they're there in, throughout Minnesota. So you can kind of find one in your area. You can search by zip code. So this is great for music therapy, but also for acupuncture, if you want to find an acupuncturist. Biofeedback hypnosis, which was mentioned in more than one study, a yoga therapist, Tai Chi, Qigong. So,
I have a friend who's a music therapist.
Yeah.
She's just a really good music.
Oh, they're incredible, the work music therapists do. So again, this is a website that my team, it's all nonprofit. There's no profit associated with this at all. It's just there for helping people in Minnesota find evidence they want to leave. Whatever they're going through. So yes, great question.
I didn't know. Let's see.
Anything else from folks that?
Yeah. Hi, Kevin. This has just been so wonderful. A part of my job with MOCA is to reach out to traditional practitioners, conventional, or what do you think is the single best thing to try to encourage people to talk to their clients just a little sooner? I mean, how do we just move that needle a little bit?
Like with the providers?
Yeah, because in my own experience as a survivor is they'll haul these resources out after you're in a pretty big funk. And it's nicer to get these sooner.
Yeah. It's like, again, it's difficult because when providers are time limited. I always tell my parents are elderly now and they get so crabby when they're at a healthcare appointment and they're waiting because they're like, my appointment was at this time, they're not ready, blah, blah, blah. My parents are crabby. And I keep telling them, I can say, if your doctor is running an hour late, that means they're a good doctor because they are not giving enough time with their patients. So if they're running late, you got the right time. They're on time, be suspicious. But also fight against the system and demand that they take the time with you that you need. I often say bring a pad of paper and a pen, bring a friend, like have your goals ready, because they may or may not ask you what your goals are. They should, but they may or may not. So having your goals ready of like, this is what I want. What do you want your health for? Like, ask yourself that question. Like, what's most important to you? And then like, and have a friend with you to help remind you. Because once that white coat syndrome gets in, like, even though I work in the medical industry, I fall for it too. Like the minute my doctor says something, it's like, okay, like all thoughts of my own left my head. I'm just listening to you and your point of view. Like it's, you know, it's just a cultural thing that we respect doctors, which is good. But we should respect our own doctor too, like our inner physician.
Having this information available at doctor's offices
Yeah.
would be really nice.
Yeah.
Because we've been in this system for a year with my daughter and had no idea that it's going on, even though that's.
Yeah. I do think the Society for Integrative Oncology is a good resource to let them know about. And if you say, I found this on the Society for Integrative Oncology's website, they're going to like pause for a minute probably and listen a little more. And like you said, like, hey, a friend of mine told me try yoga.
Yeah.
They may or may not, that might not be speaking their language, but if you say, no, here's a physician, like here's a medical provider run society that offers this, it might be like a better way to speak their language.
That's a national society,
It
I
is.
assume.
Yeah.
Do you know if they are doing any anything to try and get some of the integrative teaching to training physicians? Because I think we got to start back at the beginning of when they're getting trained, so they're not just focused on just the traditional and getting more physicians understanding.
Yeah, that's such a powerful point. I don't know specifically, they may or may not. I do know another foundation called the Weil Foundation is doing a lot of that work, not in cancer specific, but in general. That the mission of that foundation is to do a better job educating medical trainees on integrative medicine and health topics. So it is happening. It's not a lot of money in it though.
Yeah.
And
And it's not going to happen overnight.
No,
That's the
no,
frustrating
it's kind of slow but steady progress.
Yeah.
But so the Society for Integrative Oncology might be doing more too. I just don't know. They should. Because that's a great book.
Well, our time, we can keep going here, but I will just say bye to our people online. But Catherine, thank you so much. Really appreciate it. Thank you all for joining. I will send the presentation out on Monday as well as an evaluation, just to help us evaluate our programs. But just so appreciate your time and your expertise, and thank you so much.